Welcome to the Chronic Reports Ask the Doctor. Today, we have a question presented to us, and that's about what are the effects of long-term COVID? We're going to talk a little bit about that today and things that people can do maybe to help themselves through the cold and flu season. So, Patrick, that seems to be a long time, long lingering, no play on words question on a lot of people's mind, especially now that we've had COVID for a while and a lot of people are presenting with the long form of COVID. What are things that we can think about and should be doing if that's one of us?
Yeah, that's a good question. And the first thing that my question would be to make sure that it is long COVID. If somebody were to come into my clinic and they just said, "Hey, Dr. Lynch, I think I have long COVID." And I have, fit, an array of symptoms. Long COVID can present with anything. But,
Mm,
I want to make sure that long COVID is indeed what they have. And so, I would ask the individual if if they had chronic symptoms of any kind, before they had COVID. And if
mhm,
they say no, then I would make sure I would ask them questions. I would ask, because sometimes people just they deal with their symptoms and they don't
mhm,
think anything of it. And so I feel like it's my responsibility to make sure. And so I would ask them if they had, any headaches on a regular basis or semi-regular basis. I would ask them if they have any, ear issues, eye issues, any anxiety, any depression, any more hair loss than they'd like to see. I'd ask them if they have any numbness and tingling in the extremities. And all these questions pertain to before COVID. I would
mhm,
ask them if they have any sense of inflammation anywhere in the body, if they have any pain, any chronic pain where, things don't seem to be, they might be helpful, such as, acupuncture, PT, or chiropractic care, but they're not getting them through their pain presentation completely.
mhm,
I might ask if they have, acid reflux, any GI issues, do they have alternating constipation and diarrhea? Do they have brain fog, short-term memory loss? And all these questions, again, these are pre-COVID questions.
mhm,
Do they have any diagnoses? Do they have asthma? Do they have eczema? Do they have, um, anything, Hashimoto's disease or any thyroid presentations? And then if they say no, to all my questions. And, I would ask a lot, quite a bit more questions than that. But,
mhm,
that's, that's a start. And if they would say no, I've had a clean bill of health, I exercise, all the time. I eat well, I do yoga, I meditate, and, I'm a happy person. I've had these symptoms
right.
since I've had COVID. And then I would ask, okay, well, what kind of symptoms, do you present with? And if I
Mhm,
find out that, they have something like calf cramping, drenching night sweats, some sort of mental health, like they're easily triggered, um, or, maybe some burning pain in the low back and
mhm,
some, maybe some sternal pain or some cramping in the chest intermittently. If they start to, if they have some vascular irregularities, then that points to the potential for having some sort of, malarial type of infection.
mhm,
And I say potential, something like Babesia or Bartonella or something like that. And can COVID present in the same way? Yes, it can, but you want to look at all angles. And
mhm,
because one of the things that COVID can do is it can weaken the immune system
right.
to the point to where it can open up dormant infections in the body. And, things like Bartonella and Borrelia, Treponomas, and, things like this, they can cyst up and hide and multiply in cystic
Mhm,
form for up to 8 months at a time without feeding on the body. And
right.
then once the immune system is compromised, then they can start coming out, feeding on the body, leaving their antigens behind. thus start causing symptoms. And it's the type of symptoms. Another question that I might ask is, when they go into an environment to where, you know, they sense that there's some mold, there might be a smell of mildew, or there might be some visible mold. Do they react? And if they do react, then you might consider mold might be one of their elevated pathogenic loads. Uh,
Mm-hmm.
can you have an allergic reaction or some sort of immune reaction when you have exposure to mold without a pathogenic buildup of mold in your body? Yes, but commonly people who react to mold already have an elevated pathogenic load of mold. And the reason why I know this is because these people have tested positive for elevated um, mold in their body. Uh, I myself, I can walk into a moldy environment, a moldy hotel room where, that's coastal, where you see mold on the walls, on the
Yeah.
baseboard, film of mold on the windows. And granted, it might be the nicer hotel in the town, but I don't react to it. But other people, they would.
Mm-hmm.
So that's one of the things I look for. I want to make sure that it's long COVID and not
Mm-hmm.
something else. So, one of the things that I like to do is rule out the possibility of letting out dormant infections.
Mm-hmm.
And if I find that, that there is likely, that that's not the case, and these are all, clinical questions. This is
Mm-hmm.
not based off of laboratory diagnostics, but
Mm-hmm.
if I find that somebody has had a clean bill of health, their blood pressure has been normalized before having COVID, and they've had no symptoms
Mm-hmm.
at an intermittent chronic level at all, and they feel good and they're healthy, or they were healthy before having COVID. And and then they have something like, and then they present with something like elevated blood pressure, like all of a sudden, after having COVID their second time, and
Right.
a month later or 2 months later, they have the only symptom they have, and
Mm-hmm.
it's not even a symptom. They just,
Mm-hmm.
they went in to see a doctor and they noticed that they have elevated blood pressure.
Mm-hmm.
Before COVID, that same year, they took their blood pressure and it was normal, like true normal, like,
Mm-hmm.
117 over 60. And it's always been like that, and then all of a sudden, they have high blood pressure where it can get to, when they wake up and they're relaxed and their
Mm-hmm.
blood pressure is like 155 over 85.
Mm-hmm.
That's a jump. And
Mm-hmm.
so then I would consider long COVID a, a strong
Let,
potential.
let's talk a little bit about what the triggers are because
Sure.
first of all, it's a cascade of events that usually happens. And I think, I don't know, and maybe you can answer this. Is there a difference between how things like co-infections and things like Lyme presents versus the COVID? Maybe explain what is it that triggers the event that makes long COVID happen?
What triggers the event that makes long COVID happen? Having
Mhm.
COVID itself.
Yeah,
Yeah,
yeah.
having COVID itself, that triggers it.
Mhm.
And then, you rule out the possibility of other infections. I studied Dr. Horowitz's work in regards to how different
Mhm.
types of infections present. And not only that, you want to do a thorough diagnostic, clinical, questionnaire with people. You don't want them to just fill out a piece of paper,
Mhm.
I have this, and this, and this. You want to know what symptoms they have, and then you base their symptoms off the potential for, um, what infection that they could have. And not only do you do that, but before you do that, you want to check out demographics. You want to see where they've lived. You want to know the integrity of their homes and their workplaces. Did they have mold? Did they, were they sick when they lived there? Have they traveled overseas? Did they go to, tropical areas? Did they get sick? How long did it take for them to feel better? What kind of sickness did they have? You know, things like this. And, if they have a recurrence of the same type of illness after they have COVID as they did when they went to this tropical country, then you might consider wondering if there was some sort of microbe or pathogen that was cysted up, um, that came out with a weakened immune system when they had long COVID. Uh, and you want to look at, ask questions such as, have they gotten bitten by any vectors, like ticks, fleas, mites of any kind, sand fleas, sandflies, even mosquitoes. Do mosquitoes like the person? And if they say yes, mosquitoes prefer me over all my friends, and I don't know why, and I wilt up when I get bit, then that's indicative that there's a potential, other infection going on also. Um, so what triggers if somebody has no chronic infections and mosquitoes don't like them, or if they don't have chronic symptoms before having COVID, and what triggers the symptoms associated with long COVID? First of all, having COVID itself, and then when people get better. So then you have the potential for spike proteins embedding themselves in the tissues of the body you know, wherever they go. One of the theories that I have, and this is just a theory and it makes good sense, and I find this because I've asked people questions regarding to the location of their symptoms,
Mm-hmm.
is wherever we have weakness, or wherever like weakness due to injury, or wherever we have whenever we use our body on a particular side or a particular body part, that's where chronic infections have a tendency to go. They
Mm-hmm.
like to go to injured areas because they can hide there. There's inflammation there. There's not a lot of blood and body fluids and white blood cells and antimicrobials that can get to those places. In regards to, you know, they also like nourishment. They also like blood, and they also like blood flow. I was a painting contractor for many years. I used my right hand a lot, my right arm, the right side of my body, for sanding, for painting, for spraying, holding up a sprayer and spraying huge ceilings and walls and all day long. And so the whole right side of my body, was, it looked the same as my left. It was a bit stronger. I was always bracing, like bracing ladders with my left side and using the right side. So it was pretty even. But when I went through my own Lyme treatment, and I'll get back to your question here in a second, and this correlates with having long COVID, and describes where long COVID, the spike protein, can go. But um, when I went through my own, Lyme disease treatment, I had a Herxheimer reaction where it felt like somebody was pouring hot lava down the whole right side of my body. I didn't feel it on the left. I felt it on just the right, where the whole, like, it just split right in half from my shoulder all the way down my body through my right leg, to where somebody was just dumping hot lava down the right side of my body all day long for one day. It was a Herxheimer reaction. And I was like, wow, this is crazy.
Right.
I'm hoping this passes. I think it will. I was kind of happy about it because it was a big die-off reaction, but I was a little concerned as well.
Mhm.
So at any rate, that tells me that, okay, why did this happen? So I theorized that, okay, I'm a painter, or was a painter, and I utilized the right side of my body a lot.
Mhm.
There's a lot of blood flow there, a lot of nourishment there. And bacteria, protozoa, blood supply, things will migrate to the areas where there's lots of blood nourishment. Is that the case with COVID? I'm not so sure if COVID thrives off of, you know, uh, blood and nourishment. It's a spike protein. Does it have any kind of intelligence where, or not, or just some sort of reproductive matter where it feeds off of something in the body? I'm not so sure that it does. I'm not aware of that in regards to COVID yet at this time. Uh,
Mhm.
but you do have increased blood. If you have increased blood flow to a certain area, then blood is being brought to that area in large amounts over, over time. And so you might consider that, that being one factor. Um, so, in regards to long COVID triggers, it just depends on where the long COVID goes.
Hmm.
Your body is inside your body, it can go anywhere.
Hmm.
It can get into the reproductive tract, it can get into the
Hmm.
urinary tract, the digestive tract. People with, people who develop constipation, for example, the long COVID could potentially get into the tissues of the small intestine and create inflammation, causing a lack of peristalsis, and
Right.
which could, give people constipation. Long COVID can embed itself into the vascular tissue.
Hmm.
And that is a common scenario. And when long COVID, the spike protein, embeds itself into the vascular tissue, what
Hmm.
happens? Then we have an immune reaction in the vascular
Right.
tissue. We have inflammation of the vascular tissue. What happens when we have inflammation of the vascular tissue? The passageway of the blood becomes more limited. And
Hmm.
what happens then? That can cause an elevated heart rate and it can cause an elevation of blood pressure. Um,
Hmm.
Another, situation is long COVID can embed itself in the stomach,
Hmm.
in the tissues of in the stomach. So what can happen then? Um, then we have inflammation of the stomach tissue. And so if we have inflammation of the stomach tissue, could that compromise the
Hmm.
integrity of the function of the stomach producing hydrochloric acid and digestion, and even the descending action of the energy of the stomach? The stomach moves the food after it has digestion there into the duodenum, and it moves it down towards the small intestine. So if the stomach doesn't have the function that it needs because it's inflamed, it's going to
Hmm.
have what they refer to in Chinese medicine as rebellious stomach qi. And rebellious stomach qi is when food doesn't descend, but instead it ascends. And
Hmm.
people can have, symptoms such as vomiting. They could have symptoms such as acid reflux, GERD, things like that. Then we think about the neurological system. We think about the spike proteins embedding themselves into the nerves, into the brain. We think about neurological inflammation. We think about the brain. We think about brain fog, short-term memory loss, things like this. You know, the spike proteins, they can get into the vascular system in the eyes and they can cause a decrease in vision. Um, there's all kinds of things that
Right.
those are just possibilities of long COVID.
Right.
Yeah,
What about, I think the most common things we keep hearing about, triggered as, the neurological that you mentioned,
yeah,
as well as the vascular. Most people are familiar with, a lot of people having tachycardia or POTS with the heart vascular aspects. And then we have a lot of people complaining about neurological issues as well.
yes.
Um, what would you recommend, or what should people do if they suspect these kinds of symptoms might be tied to a recent infection of COVID that they had? Is there some kind of health action they should be doing to help improve their symptoms?
I do. You know, in regard, you want to think holistically, and you also want to think that if this is long COVID and it points towards the direction of long COVID, then regardless if somebody has had symptoms before or not, even if they have not had any symptoms before, people still have a pathogenic load. People still have pathogens in their body. We all do. We're all hosts for Mother Nature's microbes, good and bad.
Hmm.
And when people have long COVID, and spike protein in their body, it's going to weaken the immune system. At the same time, it's going to make the immune system work,
Hmm.
against protecting the areas of the body that have the spike protein in them, such as, inflammation and causing histamine reactions and so forth. So, the immune system jumps around, and when this happens, our pathogenic load of whatever it is, they
Hmm.
have a tendency to proliferate at a faster rate.
Hmm.
And so, what we need to do when that happens, number one, is what I would do is I would focus on not feeding anything,
Hmm.
not feeding the bugs. And this kind of goes along hand in hand with, my treatment protocol. I'm an extremist, and I need when you have uh, debilitation, you
Hmm.
have to be extreme. There is no room for error sometimes, or you die. So if you want to clean yourself up with long COVID, you probably don't have to go to extreme measures and do my diet, but you want to be careful. You want to make sure, not to eat sugars. I
Right.
would refrain from eating, dairy with the exception of butter because of lactose. I would refrain from eating red meat because of alpha galactose, which is a sugar that feeds microbes. And I would, refrain from, I would, be cautious about eating carbohydrates and be more aware of how much carbohydrates that I eat rather than just not eat them. So just be aware of those things because it's an opportunity for your pathogenic load to, increase when the immune system is compromised. In regards to cleaning up long COVID from the body, it's important to reduce inflammation. And, number one, reducing inflammation is an anti-inflammatory diet. Number two is to start taking things that help clean out the spike protein. So there has been I haven't seen proof yet from the things that have been recommended, but they're sensible and they make a lot of sense to me. And, the things that have been recommended, they seem to work. People do seem to get better. Herbal therapy can be helpful a lot. And herbal therapy to help detox the body alone can be helpful. If you
Hmm.
see a Chinese medicine doctor who is very skilled with herbal medicine, yeah, you can clean up the antigens in the body and get rid of and help clean out the spike proteins. Other things that are, a little bit easier to take that may take a little bit longer are enzymes such as
Hmm.
nattokinase, a little
Hmm.
bit bigger doses, but in the safe range to, not, affect a healthy, platelet count. I like to, recommend 200 milligrams of nattokinase per day
Hmm.
and from 500 to 1,000 milligrams of lumbrokinase per day.
Hmm.
Even serrapeptase, all of these three enzymes, the lumbrokinase, the serrapeptase, they are known to break down foreign material and foreign proteins in the body, such as scar tissue and other proteins.
Hmm.
Um, Nattokinase helps break down foreign material in the blood. So, taking those three things can be very helpful.
Hmm.
Um, and you know also dilating the capillaries with herbs and utilized with Chinese medicine like chuanzhong, which is Szechuan leverage root. About a half a gram per day is a max dose for that. It's a strong herb and you don't want to take too much of that. um, and then you want to concentrate on helping to push the blood through the vessels
Hmm.
and or help uh, neutralize the blood pressure. A couple of herbs that people can take is either Yan Huso, which is Corydalis, and Dan which is red sage root. Those are really good herbs for circulation. So, Not only are you dilating the vascular system and dilating the capillaries, but you're also helping to push blood through the capillaries and
Mhm,
regulate the blood pressure with red sage root. So
mhm,
if people have high blood pressure, red sage root will lower it. If you have low blood pressure, red sage root will raise it. I don't think that red sage root will be effective in drastic measures, but
mhm,
it's helpful, and it's something to be considered. There are lots of avenues to elevated blood pressure, so you want to make sure that you're nailing the right avenue as an
mhm,
herbalist. So, seeing a Chinese medicine herbalist, a skilled herbalist, somebody who knows what they're doing, is really, in my opinion, the best way to go.
mhm,
Will acupuncture be helpful? Yeah, I mean, I think acupuncture will be helpful, but it's not necessarily going to help clean out the spike protein.
mhm.
Yeah.
What about a lot of people are talking about things like NAC, acetylglutathione, turmeric as, ways to get at spike protein and help with inflammation. And they're maybe a little more accessible, I think, for those of people out there who might not be able to get access to some of the herbs you had mentioned. Those, I think, are pretty common in most places. What do you feel about those kinds of things?
S-acetylglutathione is excellent, and I think that it's essential. I do think that S-acetylglutathione is the optimal form of glutathione. It's 90 times better than um, liposomal glutathione. It works very well. For people who are, 100 pounds and less, and if they've had no symptoms at all on a chronic level before having COVID or long COVID, then, they can take, 800 milligrams per day, 400 milligrams twice per day. If people are, 100 to, I would say 800 up to 120 pounds. People who are 120 to, 100 and, you know, 70 pounds, 60 pounds, 160, then 1,000 milligrams per day, 500 twice per day. For people who are over 170, then 1,000 plus, up to even 2,000, per day. But if people have had symptoms before, if
Mhm,
they've had chronic symptoms of any kind before, then be careful with S-acetylglutathione.
mhm,
Um, it's you could still take it. In fact, it's best to take it rather than not, but tread slower. If you're 100 or less, then drop it to 600 milligrams per day. If you're 100 to one Actually, I would say, 120 or less than 600 per day. 120 to 170, 800 per day. 170 plus 1,000 per day. And the reason why is because people who have, certain types of chronic infections, may it be, mycoplasma or, rickettsia. If somebody has rickettsia, they're definitely going to know about it.
mhm,
Um, and, if they have Babesia, um, and even Bartonella, then if you detox these pathogens or these antigens too quickly, then it's just going to increase symptoms. So you want to detox the body without increasing symptoms. So you want to find that right dose with S-acetylglutathione. So S-acetylglutathione is key because it's the main binder. Glutathione needs to be in every cell of the body. It's produced by the liver. And when we have inflammation or liver inflammation, or when the liver is working too hard, it's not going to produce sufficient glutathione to where every cell in the body, um, where every to deliver it to every cell in the body. At the same time, the diseased cell might not be able to have that that healthy transfer of S-acetylglutathione getting in and out of the cell. So we
Right.
need to really focus on, you know, resolving the inflammation, and that has to do with dietary um, modifications and herbs. In regards to, you mentioned a couple of other things, turmeric.
Mhm.
Turmeric, yeah, I mean, I kind of laugh at turmeric. I
No
think
way, that's one of my favorites.
I know it's America's favorite herb for
Yeah,
inflammation.
I
Does it?
really think it works great.
Do you? Good.
Yeah.
Well, I mean, if you think it works great and if you actually feel it when you take
Mhm.
it,
You
then
have to take a lot. I will say that.
yeah,
But I think it's very effective. Mhm.
good. And how much do you take?
A lot.
Yeah,
Um, yeah.
like 5 grams.
Oh, yeah, probably.
Yeah.
Hmm.
And turmeric's safe to take at that much. But you don't need that much with other herbs.
Hmm.
And it's so, turmeric's okay. It's the American, reputable herb to take. Um, however, there are lots of other herbs. So if you think turmeric is good, I'll go with that. I'm
I
not,
like it because it's accessible. And,
yeah.
if you like cooking, it's
Mhm.
one of the few herbs that even after it's been heated or whatever, it still has effectiveness. So
Yeah.
if you're up on Indian cuisine and,
Right.
that's where I like to really boost it,
Yeah.
or teas,
Okay.
you can get some effect from that, from my experience.
And turmeric, it's highly antimicrobial too.
Hmm.
And that's, one of the reasons why it's an anti-inflammatory is because it stops the motility of the microbe that causes the inflammation.
Right.
So, and that's the way with a lot of these other Chinese herbs like Huang Qin, Huang Bai, um, Huang Liang. They call it San Liang, the three Liang or the three Huangs in Chinese. And it's the three yellow herbs that contain, berberine, scutellaria, uh, or berberine and bicalin, I should say.
Mhm.
And the better quality of these herbs, the better results that you're going to get. Um, so, in regards to vitamin C,
Mm-hmm.
vitamin C is excellent. And I'm all about ascorbic acid. Some people, can't handle the ascorbic acid, so then go liposomal vitamin C. I've heard a lot of trend and a lot of, talk about liposomal vitamin C. I'm not
Hmm.
sold on it yet. That doesn't mean that it's not good
Hmm.
or it doesn't mean that it's better. I just don't have experience with it yet. So
Right.
I'm not going to get on board with the recommendations of some of these doctors who claim that liposomal vitamin C is bad to the bone because I haven't experienced it yet. I've had, the doctors of the United States of America who are Lyme disease specialists all to Japanese knotweed is the best,
Right.
for, co-infections such as Bartonella and Babesia, and it's not. And not only is I put Japanese knotweed in one of my formulas just to test it out. I told myself I would never use it because it has sugars in it. And
Yeah.
it's going to, keep people in the cycle of having symptoms and kill the bugs at the same time. Will they get
Right.
better over time? Yes. Will they get all the way? Probably not. And so after a couple of years, I put Japanese knotweed in one of my formulas, just thinking, okay, I gotta at least give this a shot. And the
Hmm.
moment I put it in there and gave it to my patients, they started reacting negatively when they were symptom free already. Uh,
Hmm.
they were just on course of getting finishing up their protocol and
Hmm.
getting cleaned up. And as soon as I put it in, they started getting worse and they were staying worse. Their symptoms were coming back. And so I was just like, all
Hmm.
right, that's it for the Japanese knotweed. And so,
Yes.
that's why I say I haven't tried liposomal vitamin C. Um, it makes sense, but it doesn't make sense enough to me.
Yeah.
Um, vitamin C is a water soluble vitamin. Um,
Hmm.
I just can't grasp the idea of it being liposomal. And,
Yeah.
and so I'm not going to accept it until I try it. And if I try it, um, and it works, then I'll promote it.
Mhm.
So regardless whether you take liposomal vitamin C or ascorbic acid, both of those are going to be helpful in detoxification.
I just want to make one point here. I'm a big fan of vitamin C, as you know. That's one of my
Yeah.
go-tos.
All right.
I have done both
Mhm.
liposomal and just regular vitamin C.
Mhm.
Um, my understanding is one gets it deep into the tissue, the other gets it only to the blood level. That's
Mhm.
supposedly scientifically the benefit. What
Mhm.
I have found, and what I think is most important for people out there wanting to use vitamin C, I think everyone should use vitamin C, by the way,
Mhm.
is the quality and the kind, because there's a lot of vitamin C out there that's not pure ascorbic acid. That's the form you want, whether it's liposomal or not. And I think a lot of people just see vitamin C and they're grabbing chews or whatever, and it's not the form that they need to get the benefit, the health benefit for your immune system. So I just want to make sure that people understand that whatever they get, whatever brand they're purchasing, they want to make sure they get pure ascorbic vitamin or ascorbic acid, which is vitamin C.
Yeah.
So
Yeah.
yeah.
I agree 100%. Yeah. Right on.
Yeah. No matter what form, tablet, whatever, I find, and it's very effective. You'll notice a difference too. That's where I've noticed the differences. If
Mhm.
you're getting some, crazy popular formula, popular brand name in a
Yeah.
gel cap or whatever, but it's not pure. A lot of them, or, the source that it comes from,
Hmm.
whatever material they're using, rose hips versus ascorbic acid or whatever, it
Yeah.
makes a difference. And I know when I'm sick and I've used vitamin C to help overcome an illness, it's always the pure form that is the superior form.
In regards to, long COVID with stomach issues, the actual
Mhm.
stomach, right
Mhm.
below your xiphoid process, inflammation of the stomach tissue, GERD, acid reflux,
Mhm.
vomiting, things like this. Um, I find it best, and I have found this clinically, that if people drink their herbs, rather than take them in capsules, there's
Mhm.
symptoms associated with stomach inflammation reduce quicker.
Mhm.
And in some cases, they probably wouldn't reduce unless, you do that. I don't know for sure. I mean, I don't know. Maybe someday they would, but clinically, I've seen that if people, if they take an encapsulated formula to help resolve toxicity and or um, clean out the tissues, take the herbs, take the powders out of the capsules, put it in a cup, put some hot water in there, cool enough to drink, and do it on an empty stomach, not on a full stomach, but you can still do it, with food. Um, and it might be better to do it with food also. But if you do it without food, then you're more likely to have the herbs, just diffuse into the tissues of the stomach and help resolve the inflammation and the cause of the inflammation sooner than later. And if you take them with food, then you might help reduce inflammation of the stomach while your stomach is digesting the food.
Mhm.
So, it can be good both ways. Or if you drank the herbs before you ate food, to
Mhm.
help reduce the inflammation. Like, for example, if you wanted to take turmeric and scutellaria and, philodendron and, some other herbs before you ate, like, let's say 15 minutes before you ate.
Mhm.
And, you took a good, healthy, strong dose of these things, you could really reduce the inflammation of the stomach to where when you go to eat something, you might not have that, that rebellious action of the stomach. Yet the
Mhm.
stomach might function better and digest your food better before it passes it down into the duodenum and into the small intestine.
Mhm. It's interesting. Do you think it's the direct action? You know, does the gel cap just kind of slow things down, or what do you think it is?
Well, if it's um, if they're veggie caps, they're designed to bypass the stomach acid. So they're designed not to open up in the stomach. They're designed to get into the small intestine and then start doing their jobs in the small intestine.
Mhm,
So if you're bypassing the stomach, you can still and will still eventually the herbs, the biochemical properties of the herbs will be integrated into the vascular system and find their way to their stomach. Um, Eventually, if the body chooses not to work on other things,
mhm,
uh, or if the biochemical properties of the herbs aren't used up before they get to the stomach,
mhm,
um, I think more of the properties will get to the stomach and into the tissues of the stomach when you take them out of the capsules. In fact, I know they do because I've seen this clinically. Uh,
mhm,
so when you drink the herbs,
mhm,
they get right into the stomach. They're there.
mhm,
When you take the herbs in capsules, they bypass the stomach, get into the
mhm,
small intestine, and then the small intestine absorbs it, gets into the blood, and then it flows all around the body into, distributes the biochemical
mhm,
properties into all kinds of tissues in the body. And then whatever it has left, gets to the stomach also.
mhm.
And so, when does it get to the stomach? You know, um, After, during circulation. Uh,
Right.
I don't know. I'd have to think about that, but
No,
uh,
that's super interesting, especially when you consider, and you touched on this earlier, uh, these things tend to hide in tissue or gravitate toward tissue. And I know from things I've read, studies I've read, uh, COVID likes stomach tissue and GI tissue and hides there. And
yeah,
so that makes a lot of sense what you're saying and how this would be effective.
yeah.
Mhm,
I think I've been telling myself lately that I need to reel it in a little bit. And even though I'm symptom free and I don't have any, signs of elevated blood pressure or anything like that, I've had
mhm,
COVID a few times.
mhm.
And granted, I had Lyme disease, co-infections, mold, all the things. And even though I cleaned myself out, it's always good to keep yourself clean.
Yeah.
And, that's the way to prevent chronic illness is to just, you know, keep doing the work. And you don't necessarily have to do it on a daily basis, but, choose a month out of every 6 months or, you know, be aware of your diet and your teas and what you're doing to your body.
Mhm.
Yeah,
I
exercise.
agree.
Yeah,
Well, thank you, Patrick.
yeah, my
This
pleasure,
has been
Nicole.
great.
Yeah, it has been great.
And thank you for tuning in to another episode of Ask the Doctor. See you
Take care,
next time.
everybody. All right, have a
Bye.
great day. God bless.